Good morning. My name is Vinquez Askew, and today I will be doing a presentation on the topic of abortion, answering the question, is late-term abortion morally and ethically an acceptable practice? There are about 1.2 million abortions performed each year in the United States. Abortion is characterized as the intentional expulsion of an embryo from the belly of a human female. 1 out of 4 women will have an abortion by the time they are middle aged, which implies that one may know someone who has had a fetus removal. Most happen during the principal trimester of pregnancy. A late term abortion happens during the second or third trimester of pregnancy. Planned Parenthood, one of the biggest organizations that performs abortions, reports that about 18,000 third trimester abortions are performed every year. Abortions after 24 weeks comprise less than 1% of all abortions. Teleologic theory would suggest that the ethical decision would focus on the outcome of the abortion and its effect on society. Further, utilitarianism, a subcomponent of the teleological approach, would suggest that if the outcome has value for everyone, then it is good. Utilitarianism prefers to judge each individual case on its own merits, meaning late term abortion would be very much up to the mother and what the consequences would be for her life. Late term abortion is legal in many states and ethical. On this hand, while fetus removal can be the unfortunate end to a pregnancy, it is never viewed as murder. Late term abortions are legal in the United States under Roe v. Wade, which decided in 1973 that doctors have the right to decide the fetus viability, its ability of sustained survival outside the woman's body with or without artificial aid. The court has likewise determined that abortions ought to be legitimate if proceeding with the pregnancy would genuinely undermine the woman's life or well being. When late term abortions happen, it is typically on the grounds that the embryo has been found to have lethal condition that could not be recognized before. It has been affirmed that a baby does not feel torment until well into the third trimester. Babies do not build up the neurological wiring that would enable them to feel torment until at any rate 24 weeks. Pain sensation requires neural connections into the cortex, and the cortex is not functionally developed until the 26th week or later. No one shows up at the choice to have a fetus removal following 24 weeks thoughtlessly. Reasons someone would have a fetus removal during the third trimester include lack of medical providers, which happens in numerous states to make getting an abortion difficult, financial hindrances, and lethal fetal abnormal, abnormal, abnormalities. Lethal fetal abnormalities could cause birth defects and lethal malfunctions. Extreme birth defects like cerebral palsy or spinal bifida can produce prolonged inability or even death. Severe birth defects are the leading cause of infant death in the United States. Practical or formative birth defects cause a body part or framework not to work appropriately. These frequently cause inabilities of knowledge or advancement. In some parts of the world, lethal malformations represent one of the only situations when abortion is legally permitted. Various states have accordingly established hurtful gestational age restrictions that are philosophically persuaded and not situated in science. Even in states where late-term fetus removal is permitted, deterrents still exist. These deterrents comprise of medically pointless ultrasounds, require 24-hour holding periods, and 2 in-person meetings to a facility. These are all set in place to extend the opportunity and guide the patient to change their minds. One state in particular, New York, has passed the Reproductive Health Act that extended fetus removal rights, decriminalized abortion, and wiped out a few limitations on the late-term abortions in the state. On the other hand, late-term abortion is illegal in many states, and it is an immoral practice at what is being discharged is not a clump of cells but a child. Conduction of this operation supports the idea that there is no absolute value placed on human life, meaning it avoids moral questions about when human life begins. 16% of abortion facilities terminate pregnancies that are 24 weeks along, when many fetuses are viable outside the womb. In the event that a woman assented to sex and additionally did not appropriately utilize contraception, at that point she realized that pregnancy may be a result. Constraining women to convey pregnancies to full term is the most moral decision. It is subsequently dishonest to attempt to forestall any outcome. It is indecent for an infant to be torn from the mother's belly minutes before birth. Pro life advocates state that life starts at origination. Protecting unborn children from feeling torment in the mother's belly is essential. Lethal malformations is utilized for end of life choices, a condition that constantly prompts passing in the infant time frame, paying little heed to endeavored steady treatment. Some accept that these children will not have a life worth living, so the most ideal alternative is demise. Practically none of the quantity of the late-term abortions time frame are out of clinical need. The law perceives no special cases for criminals who murder children. A child murderer is a murderer, regardless of who employs the blade. Late-term abortions are not as uncommon as measurements state and are not exclusively done when a woman's well-being or life is at stake. Explanations behind late-term abortions being a direct result of movement, contemplations, cost, hesitation, and conflict with the father is not worthy and indecent. Here is a list of references for further information if you would like to learn more on the topic of late-term abortion and abortion in general. Opinion 1. It is unethical to force a woman to continue with birthing a child when they cannot care for him or her and will not want him or her. My opinion is based on a deontology approach. The profound quality of an activity ought to be founded on whether that activity itself is correct or wrong under a progression of rules instead of dependent on the outcomes of the activity. I feel like an embryo is the equivalent to a human being. The embryo will grow to be a kid and later an adult. The embryo is just at a lower phase of improvement. At that point, at the point when individuals state the unborn is not an individual, they imply that it has not developed yet or picked up ca- uh, capacities that show up sometime down the road. I believe that women who choose abortion because they consider themselves unsuitable mothers are picking the best ethical option. Regardless of whether the embryo is not an individual, this does not imply that it cannot have an ethical standing. Numerous individuals object to abortion later in pregnancy since they naturally feel that there is something more human about an embryo which looks so much like a child. Anti decision activists depend intensely upon this, and they have a point to a certain degree. Not allowing women a decision to conduct late term abortions is not valuable with equal vote based states. I believe most care, I believe that we should care and be merciful, and it is important to acknowledge that for some women, the decision of late term abortion is hard and confusing. The greatest misconception about late term abortion is the system of hypotheticals versus reality. It is essential to teach and welcome mindfulness of the subject of late term fetus removal as opposed to making presumptions. In pregnancy, late term signifies to be recent weeks of development or past a patient's expected date. Abortions do not happen in this time span, so the expression is opposing. Late term is a development of hostile to fetus removal radicals to confound, misdirect, and inspire the picture of an infant being murdered just before death. The fitting language is fetus removal later in pregnancy. The second opinion, the greatest misconception about late term abortion is the system of hypotheticals versus reality. It is immoral to indicate that healthy women with sustainable pregnancies unexpectedly decide to pursue abortion as the answer. Late term abortions usually happen because of lethal fetal irregularities uh, or risk in the well being of the mother. Because embryonic growth challenges and abnormalities do not build until later in pregnancy, when they do appear, it becomes critical and coincides a woman's life. In this instance, late term abortion is the safest medical procedure. Every pregnant woman's condition and medical circumstance are different. There is no way to resolve every woman's case to determine what is the suitable care. I believe it is not an easy thing to conduct ethical decision making in the intricate medical situation. Regardless of a woman discussing her medical complications as a reason for a late term abortion or not, I do not believe one can make a decision for someone when they themselves are not in their situation. Judging women for making a decision is a form of prejudice. We do not know the conditions of every pregnancy. Most who have late term abortions are making decisions for what is best for themselves and their families. Some use what is religiously ethical as an argument, but I believe religious values cannot become the foundation for laws. It is absurd to constitute late term abortion cases. All pregnancies bring dangers, but it is the responsibility of the woman to consider the dangers in her decision making. Restricting a woman's right to do what she pleases with her body disseminates gender inequality. Women will agonize and some even decease from pregnancy complications if late term abortion was not an option. Wouldn't this too be unethical? Women are more than carriers of potential life. Failure to offer an option of abortion is morally wrong, in my opinion. Fetus removal and late term abortions has been a subject of contention for a long time. There has been much discussion about the legitimateness of late term abortions, including discussing the lawful status of the unborn. This discussion boils down to morality and science. In the event that the unborn is an individual, is late term abortion considered immoral or an act of science to better the health of a woman? Late term abortion might be defended as important to women independence, yet that would not imply that fetus removal is naturally moral. An inability to transparently talk about late term abortion can cloud significant conversations. Excuse me. I believe we as a people have to do better with communication and education of this topic for change to be implemented, regardless of which side any individual is on. Important questions that can be debated upon that gets brought up about this topic is one, should fetus removal be prohibited and dealt with like the homicide of a human individual or stay a legitimate decision accessible to all women? Two, should mothers give fathers any stake in choosing whether the pregnancy is conveyed to term? And three, if men have a moral commitment to help a child after birth, do they have a moral case on whether a child is conceived? This concludes my presentation. Thank you.